I received several requests to do a summary show on supplements to prevent COVID-19 because my other shows, although interesting, were too long and we need to go into amounts. We're going to talk about 6 supplements that can potentially prevent and treat COVID-19. Not my words, researchers' words, not my words. Before I get into it, don't forget we have a medical disclaimer. Do not take any supplements without talking to your doctor. Do not take any supplements, particularly if you're on any medication. Do not change any medications whatsoever. And right now, we are not forming any doctor-patient relationship of any kind. Okay, let's get into the 6 supplements. Now, I'm just going to read the titles of these articles that I talked about recently on this show of why I can use these words. This is one article out of the journal Biochemy in August of 2021. The title is Essential Sufficiency of Zinc, Omega-3 Polyunsaturated Fatty Acids, fish oil, vitamin D, and magnesium for the prevention and treatment of COVID-19, diabetes, cardiovascular diseases, lung diseases, and cancer. There are 351 references in that article. It's easy to find. You could just put it into Google if you want to read it. The second article, which is why we're talking about these supplements here now, that are talking about prevention and treatment of COVID-19. The second article is Zinc, Vitamin D, and Vitamin C, Perspectives for COVID-19 with a focus on physical tissue barrier integrity, meaning protecting your cells, okay? That article was out of Frontiers in Nutrition on December 7th of 2020. There are 200 references with that article. Here's our list. First one is omega-3. Omega-3 fats, which is fish oil. Here's a little bit about dosages. If you want to research this a little bit more, just go to my website and I've got all this stuff on there in detail. Infants, obviously, if infants are breastfeeding, they're going to get their omega-3s through breast milk. So I always encourage moms and dads-to-be, if you haven't had children yet, but you're going to, get your omega-3 levels up, get them checked and get them up before conceiving, and then obviously continue through pregnancy, and then you can continue through breastfeeding. So that's how infants get their omega-3s. Infants, children, pre-puberty, you should have more of the omega-3 fat called DHA than EPA. That flip-flops when you're an adult. Then you want EPA more than DHA. DHA is more for brain building. EPA is more for anti-inflammatory effects, okay? More DHA in children, more EPA as adults. 900 milligrams of EPA and DHA per day for children. And then for adults, remember that we want that ratio, the ratio of omega-6, bad fats, bad, to omega-3 fats. You want to get that level checked by a practitioner that's familiar with these kind of things. You can get your level checked. Ideal should be 1-to-1 or 3-to-1. You're at risk of a chronic disease if you're at 15-to-1. The average American is 25-to-1, and I've seen way worse than that. Adults should be taking about 3,000 milligrams or 3 grams of omega-3 fats. When you combine those two numbers, you add EPA and DHA together. You want to be taking 3,000 milligrams per day, maybe a little less if you're 100 pounds, maybe a little more if you're 250 pounds, right? So you can judge that as is, but that's about where you want to be. Remember that liquid is better than gel cap because it's cheaper, less packaging, and so forth. There's your omega-3s, okay? Next is vitamin D. We're going to talk about vitamin D. Now I'm going to add vitamin K in there. You probably know that vitamin D helps with calcium absorption. Vitamin K directs your calcium to go to bones and not elsewhere. That's why you want to combine in the vitamin K. You should know your vitamin D level. Most doctors are testing it fairly regularly now. I believe nanograms per deciliter, your number should be at least 50 to 70 is what many people are taking. I have yet to see one person, including myself, have adequate vitamin D that are not already supplementing. Everyone is low as I've seen so far. Don't take any supplements unless you talk with your doctor, particularly if you're on medication. By the way, with omega-3s, if you're taking a blood thinner, check with your doctor. Do not take fish oil until you check with your doctor to find out the appropriate level. if you're on a blood thinner. With vitamin D, you do not take it if you have sarcoidosis or other granulomatous diseases. Look that up, check it out. If you've got something, you need to check that out. So vitamin D3, infants is 400 international units per day, 400, very small amount. Pre-puberty, 2,500 international units per day. We usually go by this, 1,000 IU per 25 pounds of body weight. So if you're 50 pounds, that's 2,000, 75 pounds, 3,000, 125 pounds, that's 5,000. That's about where we want to be. Adults is 5,000 IU per day. Obviously, if you're lighter than that, you're 100 pounds, maybe it's 4,000. If you're 250, you could probably do 6. Dr. Anthony Fauci, just as a reminder, he takes 6,000 international units of vitamin D every day, and he takes 1,000 milligrams of vitamin C every day. More of that in a moment. If your level is low, if your vitamin D level is low, you could take 10,000 IU of vitamin D per day for, say, 6 months and then recheck. Make sure you know your level. And I have yet to see anybody be too high. I've yet to see that as well. Most good products are combining the vitamin D and vitamin K together in appropriate amounts. That's your D. Next up is zinc. You can look up zinc forms and so forth. I think 20 milligrams is about what you need to take. And just keep in mind that a multivitamin is not going to cut it for most of these things. You can't cram everything you need in a multivitamin. You're going to find that multivitamins will have a lot of what we're talking about, not fish oil usually, a lot of what we're talking about, but it's not going to be enough. Not going to be enough, okay? So zinc, consider 20 milligrams. So that's what you want to be taking here. Zinc, that was talked about in our research articles here. Vitamin C, I think everybody understands that vitamin C is something that we can be taking. I said Dr. Anthony Fauci takes 1,000 milligrams per day. I think that would be a bare minimum. If you're ill, you can be certainly taking more of these things. If you're ill, you could be taking 40 or 50 milligrams of zinc. You could be taking 3, 5, 6,000 milligrams of vitamin C broken up into doses throughout the day. Do not do that unless you're working with your doctor, please, your healthcare practitioner that is familiar with these things. I mean, people are taking IV of vitamin C and other antioxidants and vitamins and so forth at much, much higher doses. So you could take many thousands of milligrams of vitamin C per day, particularly if you're ill. Next on our list is magnesium. Magnesium, keep in mind, is contraindicated in people with kidney failure, myasthenia gravis, excessively slow heart rate, or bowel obstruction. So those are contraindications to magnesium. Check with your doctor. So the range here is between 3 and 4.5 milligrams per pound. So translating out, that's 300 to 900 milligrams of magnesium per day. I personally take 500 or 600 milligrams per day. I've taken up to 900 just to see what would happen. Nothing happened. You can titrate that down a little bit more. If you're 100 pounds, maybe it's 300 milligrams. If you're 250 pounds, maybe it's more like 900. Start slow and build it up and see what's going on. Certain forms of magnesium might cause loose stools. Be aware of that. My recommendation is look into it. I've done videos specifically about magnesium on this show. Look at that information. And magnesium oxide is one that you probably want to avoid. That's a cheap one that you're going to find in stores. People smarter than I have said that's not the best active form that you can take. And you could take other magnesium products that have a varied magnesium forms in them. So again, talk to a practitioner that is familiar with these things. Lastly, was not mentioned in these articles, but I've talked about it before, is quercetin. Quercetin is a bioflavonoid, kind of like vitamin C. It's an anti-inflammatory antioxidant. Good data about quercetin and the immune system, quercetin, and specifically COVID-19. On average, how much quercetin to take? You could take 300 milligrams. Maybe again, if you're a little lighter, 200 milligrams. Maybe a little bit more if you're heavier. And other doctors have said you can take up to 600 milligrams or more per day of quercetin if you're ill. So you can up these things if you're getting sick. Here's our supplement list. I was requested to do a short one on amounts suggested. Remember to talk to your doctor first. I'm Dr. Scott Fuller. Thank you.